You know, when you get that routine blood test done, ever wonder what exactly your doctor is looking for? Well, one of the biggest clues to your overall health is hiding in a protein called albumin. Today, we're going to pull back the curtain on what it does, why it gets tested, and what those results really mean for you. So, let me ask you a question. What do you think is the single hardest working protein in your entire bloodstream? If you guessed albumin, you are spot on. This little protein is an absolute powerhouse, and it's so important for your health. So, what even is albumin? Well, in a nutshell, it's a protein that your liver makes. And it's not just any protein, it's the most abundant one swimming around in your blood plasma. You can kind of think of it as the ultimate multitasker of your bloodstream, constantly juggling a few really critical jobs to keep you going. Albumin really has two main gigs. First, it's like a bouncer for your blood vessels. Its job is to keep fluid inside the vessels where it belongs. Without enough albumin, that fluid can leak out into your tissues, and that's what causes swelling. Its second job, it's like a high-speed delivery service, zipping around your body carrying vital things like hormones, vitamins, and enzymes to exactly where they need to go. Okay, so why would your doctor want to test this in the first place? That's a great question, and it really boils down to one of two main situations. On one hand, it might be totally routine. It's often included in a big picture checkup, like a comprehensive metabolic panel, or CMP, just to see how everything's looking in general. But on the other hand, it might be ordered for a much more specific reason, like if you're experiencing certain symptoms that could be pointing to an issue with your liver or kidneys. For instance, if your doctor's thinking about your liver health, they might be on the lookout for signs like jaundice, that yellowing of the skin and eyes, or things like weird swelling, feeling tired all the time, or just losing your appetite. These are all little clues that your liver might need some attention. Now, what if the focus shifts to your kidneys? The signs can be a bit different. We're talking about things like swelling in your hands and feet, changes in how often you need to pee, or even urine that looks foamy. Any of these could prompt your provider to check your albumin to see how well your kidneys are doing their job. All right, let's talk about the test itself. And I've got some good news here. It's incredibly simple and routine. If you've ever had blood taken for any reason, you already know the drill. A healthcare professional cleans a spot on your arm, there's a small needle, and they collect a little bit of blood in a tube. That's it. And the whole process is unbelievably quick. Seriously, from the moment they start to the moment you're done, it's usually less than 5 minutes. And in terms of risk, there's really nothing to worry about. You might feel a tiny pinch from the needle and maybe get a small bruise later, but it typically fades away in just a day or so. So, do you need to prepare? Well, for just an albumin test, you usually don't have to do anything special. Now, if it's being done with other tests, your doctor might ask you to fast, not eat or drink for a bit. But here's the most important thing. Always tell your provider about any and all medicines you're taking. Some of them can definitely affect the results. Okay, let's get to the part you've been waiting for. The results are in. What in the world do these numbers actually mean? Let's decode them. First things first, and this is absolutely crucial to remember. An albumin test, all by itself, cannot diagnose any condition. I want you to think of it as just one clue, one piece of the puzzle that your provider uses to see the whole picture of your health. Generally speaking, if your levels come back lower than normal, it could be a sign of a few things, maybe an issue with your liver or kidneys, malnutrition, or even an infection. On the flip side, higher than normal levels are actually pretty rare and often just point to dehydration. But wait a minute. Does an abnormal result automatically mean you have some serious medical condition that needs treatment? The answer, thankfully, is no, not always. And this is so important because lots of other things can temporarily affect your levels. For example, some medicines like steroids can actually raise them. Others, like birth control pills, can lower them. Even just being pregnant or not eating for a day or two can shift the numbers. This is exactly why context is everything. So let's bring this all home. You've had the test, you're looking at the results. So what's the most important thing to do next? Here is the number one takeaway from all of this. Your test result is not a final verdict. It's not the end of the story. It is the beginning of a conversation between you and your healthcare provider, a tool to figure out what's going on together. So I'll leave you with this question to think about. Now that you know all this, what's one thing you've learned today that's going to help you feel more prepared and more empowered at your next doctor's visit?